There's been outrage across the country after thalassaemic children in Rajasthan contracted HIV/AIDS as well as hepatitis C from blood transfusions after they received blood in a government hospital. But it's not just in Rajasthan. Most hospitals across the country don't have the NAT facility, a facility that all developed countries have, which can test for infections. And while the costs may be high, it's a small price for human lives.
Around 200 thalassaemic children in Rajasthan have contracted hepatitis C and HIV because they were given infected blood. A misfortune that could have been avoided had the government hospitals used NAT, the nucleic acid testing, while checking blood received from donors in the first place. A test mandatory in many developed countries, not in India. A 2009 study by the All India Institute of Medical Sciences found that the ELISA method of testing blood was not entirely safe. It recommended that NAT be made mandatory in India to ensure the safest possible blood supply. Only 13 centers in the country use NAT, one of them Mumbai's Hinduja hospital, the only NAT facility in Maharashtra. What makes NAT superior to ELISA? For one, it helps detect infections earlier. Say in the case of HIV, ELISA detects infections between 3 to 6 weeks, while NAT takes 5 days. For hepatitis C too, it takes 5 days, while ELISA can take up to an average of 2 months.
Time lag between infection and the detection is the window period. So with NAT, this window period is reduced quite dramatically. We are looking directly at the virus DNA or RNA. That means we are looking at the molecular level.
The reason NAT loses out to ELISA is the cost factor. The equipment costs up to rupees 60 lakhs to install, the cost per test nearly 2,000. Yet it's a small price to pay, where human lives are concerned. In Mumbai, Shai Venkatraman for NDTV.